Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Segmental Scruples edition or series. This audio podcast is part of a Rampage Sonar. This audio podcast as part of a Blitz Logistics, and this audio podcast as part of a Storm Logistics production. In this audio podcast, a little bit around the importance of research in context in context and in regard to leadership and management to inform best practice or best practices and sort of theme and looking at sort of theme four in around this works. So healthcare professionals and scientists who are in transfusion in around transfusion practices and those who sort of work in transfusion care and research uh, and expect proficient sort of guidance from and at sort of organizational level to provide leadership and to help ensure safe and effective practice. These so There have been guidelines which are consistent with comparable statutory or regulatory standards and provide guidance for individuals with practice which is which for individuals whose practice, for example, may be non-regulated. That is thus where, for example, the Institute of Biomedical Sciences, or IBMS, had documented um, the IBMS good professional practice guideline had informed uh, sort of where science professionals are encouraged and have a professional should have a respect should have a professional sorry should have a professional responsibility to offer advice and expertise to individuals, teams, and committees or working groups where input can contribute positively to a service or project outcome. The IBMS also the IBMS an IBMS guideline also informs where science professionals work as a part of broader professional team. They must work in a collaborative and cooperative manner with other members of the team with a view to achieving the best possible service or outcomes. In regard, the scientists at all levels in the care and support of patients or recipients with chronic illnesses or long term conditions or long standing conditions who may require RBTs are now must now take a more sort of vigorous view of how research has an importance in around leadership and management to inform best practice or best practices. More critical as healthcare professionals should seek to recognize the importance of renal health in all recipients or patients who are potential sort of are potential candidates for RBTs and prompt any concerns through multidisciplinary team meetings or what has been referred to in guidelines as specialist interest groups or SIGs. Reliable observations to guide transfusion practice and well conducted trials to determine what transfusion strategies or practices work best are now unnecessary to really ensure that the importance of research and leadership and management help inform best practice or best practices. That draws this audio podcast to a close. It's been an audio podcast as part of a Segmental Scruples series or edition. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics. And this audio podcast as part of a Storm Lobostics production.